This April marks 60 years since Dr. Jonas Salk's polio vaccine was declared safe and effective. Billions of children have received it worldwide, and polio can now be found in only 3 countries: Nigeria, Afghanistan, and Pakistan. But how close are we to seeing the disease eradicated entirely? It's a question VOA health reporter Carol Pearson is here to talk to us about. Thank you so much for joining me.
You're welcome.
Tell me something. Once we were thinking that we're done with polio, it's not going to come back. Yet the disease has been around for such a long time, and we haven't been able to find a cure for that, even though we have a cure, but countries and people are reluctant to use it. What do you think is going on?
Well, actually, there isn't a cure. There is a vaccine that prevents it. But if you have polio, there's no cure for it. So that's why this worldwide polio eradication effort is so important, because it prevents people, mostly children, from becoming paralyzed, from suffering the after effects of polio, which can last a lifetime.
Why do you think countries are reluctant in pursuing the vaccine?
You know, it's the same reason that some parents in the United States are against vaccines. They don't understand the importance of it. They don't have the education, and then in some countries, like it's in Afghanistan because it's in Pakistan, and it's mostly on the border between Afghanistan and Pakistan. War and conflict have prevented people from getting into those countries and vaccinating all the children.
Do you think it has something to do with cliches, that people have some misconceptions about what this vaccine can do?
Oh, sure. You know, in Nigeria, for example, there were some people who were concerned that it could make them sterile or that it could give them HIV. So it's a matter of understanding that the vaccine is safe, it's effective, it doesn't have bad side effects, and study after study after study has been done to show that, and that it actually protects their children so they can grow up healthy and lead productive lives.
Let's talk about Nigeria, for example. We have seen some progress. How do you think they've done it? How do you think they came so far in the quest to eliminate polio from that country?
A lot of it is political will and having the health establishment behind it. It's a matter of educating the public and getting the word out, you know, enormous education campaigns, and then getting people whom they trust in each community to convince others that this vaccine is helpful and that it is safe.
Do you think working with local communities, so people who are trained can go out and talk to them in their local languages and tell them and give them examples and facts that, hey, this is not any medication that would cripple your children. In fact, it would save them from that?
Oh, that's essential. It's essential in every outbreak, whether it's polio, Marburg virus, Ebola. I mean, that's one of the big reasons why we're now seeing a downturn in Ebola, is because they've gotten community leaders behind the prevention methods. So getting community leaders involved is very, very important if you want to stop a disease.
How long do you think we're talking about realistically in terms of eradicating the world from polio?
Through education, through the efforts of a lot of community workers and medical people. You know, you don't have to be a medical person in order to give somebody 2 drops of a vaccine, but you do have to be trained, and you do have to have the trust of the community. So they're hoping, the World Health Organization is hoping that by 2018, there will be no more new cases of polio. Nigeria has not seen any polio in the past 8 months, but it takes 3 years to be declared polio-free.
Well, thank you so much for your insights. We'll keep an eye on that. Looking forward to 2018.
Good.
Thank you. Carol Pearson.